Hi, this is Shannon, and this video is really long overdue for a number of reasons. I mean, life gets in the way and such. But I kind of wanted to update anyone and everyone who is curious about what happened after my jaw joint replacements and how I'm doing now. And you'll have to excuse my chubby cheeks. I'm on a lot of steroids right now, so they're kind of bunny-ish, but I have big cheeks anyway. I mean, I have dimples, so it comes with the territory. Anyway, I developed MRSA. I got a staph infection in my right implant and actually had to have it removed. I started having pain in that implant, I believe October 11th. Shortly after my surgery, I started having pain. I just woke up one morning and it was just excruciating and I had no idea why. But my gut was telling me that something was wrong. And I was going to my surgeons and I was being told that it was muscle inflammation, which, I mean, makes sense because I do have a history of rheumatoid arthritis, but I do have to say one of the biggest things that I've noticed in all of my years of being ill is doctors have a tendency of assuming that because you have a history of inflammation issues, that any issue you have is inflammation related. If that makes sense, it should. But I just had a gut feeling that it wasn't muscle inflammation. I know what inflammation feels like on a number of different levels, and my gut was just telling me that that wasn't it. So I would kind of go back and forth and being like, you know, it still hurts. It swells up sometimes. I didn't have a fever or anything like that. I didn't have any red streakiness or anything like that. I really had no symptoms for it at all. So I woke up, I believe February 8th, and it was swollen the size of a golf ball sticking out of my face. And I will insert a picture so you can see it. It was absolutely lovely. My thought process was really slow. I couldn't really carry on a conversation that well. It was really odd, quite honestly, and it hurt really bad. And I texted my mom and I was like, Mom, my implant is really swollen, the implant area. You should probably look at it. And she was at work, and I felt like it couldn't wait for her to get on break to come see it. So I had one of my sister's friends drive me to her job, and she saw it and instantly broke down crying. And she was like, oh my God, it's infection, blah, blah, blah. And so we immediately left her job and headed down to my surgeon's clinic. And I called them and I was like, I need to be seen today. This cannot wait. It's urgent. If you can't squeeze me in, you're gonna have to, essentially. And so they squeezed me in. I believe my surgeon was in surgery when I was there, so I saw one of his residents. And she took a picture of it and sent it to him, and he was like, she needs to get a CAT scan. So I did the next morning. And got a call back on our way home saying that I needed to be admitted and the implant needed to come out because it was infection. And I instantly started crying, cried for about 20 minutes, and that was it. Because I'm the type of person where I give myself a small time frame to kind of just vent and let everything out. And then I'm like, okay, I got this, I'm gonna do this, I can do this. And that was the only time I ever cried over the entire situation because I don't like crying. I like to believe I don't have tear ducts. And so, I mean, who likes crying? It's not fun. Anyway, so we turned around, I got admitted. I was on antibiotics for about 2 days before the surgery, and then February 10th, the implant was removed. My mouth was 100% wired shut. and I had an acrylic spacer put in. It was not fun. Obviously, it was not fun. I was on an all liquid diet for, I want to say 7 to 8 weeks, somewhere around that time frame. It was mostly pureed bean soup and beef stew, which was really gross. A lot of milkshakes, a lot of Ensures, a lot of just anything basically that would taste decent pureed. Which it actually wasn't that bad. Pureed bean soup is actually not that bad. I could make a recipe book of liquid food, and I mean, I found a lot of stuff that actually was not bad. Anyway, so my mouth was 100% wired shut, which drove me crazy because I love brushing my teeth. I don't know if that's weird, but I do. I have really weak enamel. My teeth stain really easily. They always have. I brush my teeth like crazy, but I still have gotten cavities, and I don't know. We have genetically straight teeth, but weak teeth, so that's not fun. But it was also really hard on my teeth because I had to use a really strong mouthwash as a substitute for brushing the back sides of my teeth, and it really, really hurt my enamel even more. It hurt my gums. I have sensitive gums, and my gums have pretty much not been the same since that whole ordeal. They are receding a bit. Whenever I brush my teeth now, it's quite painful because it hits a nerve every time I brush them. So it's just like it's like a strong pinching pain whenever I brush my teeth now, which is kind of a bummer. But it is what it is. It could be worse. I could have lost all my teeth or something like that. So my mouth was 100% wired shut. I had a PICC line in my arm for the duration of the time as well. And I actually had the PICC line longer than I had my mouth wired shut, because my mouth was unwired for about 2 weeks before the implant was put back in. Anyway, so I had the PICC line, and I was on 2 different antibiotics. At first I was on vancomycin, but I got red man syndrome from it, and I would have had to have been pre-treated with Benadryl the entire time, and that would not have been fun. So we switched it to clindamycin, which was effective as well. So we did clindamycin and another antibiotic that I cannot remember. I can never remember the name of it. I think it was every 4 hours, 4 to 6 hours, something like that. I cannot remember. And my mom would help me because I couldn't be alone while doing it, because at any given moment you can have a reaction to it, or a reaction to a number of the other medicines I was on. I don't know. So I could never be alone. And I had to completely wrap my arm when I showered. So the PICC line didn't get wet. The PICC line was changed once every week. Let's see, I was on a lot of pain meds, but I hate taking pain meds, so I try not to take them as much as I could. I don't like feeling like I don't have control over my body. So I tortured myself and was in a little bit of pain during the time because I don't like pain meds. I just don't. Anyway, going back to the story. And I had a at-home nurse bite off the cap of my PICC line with her horrible hygiene teeth. And I feel bad for saying that, but it was the first thing I noticed whenever I met her. They were so bad. And I was kind of like, okay. I didn't know what to say. And I wanted to be nice. She wasn't wearing gloves, and she didn't rub the area down for as long as she did. And she kind of kept it open for a really long time, and you're supposed to have it done in a certain time frame. And I was kind of like, shouldn't you be wearing gloves? And she was like, honey, I worked at such and such hospital for over 30 years. I think I know what I'm doing. Okay. All right. For one, you are never supposed to talk to a patient like that. 2, if your treating a patient or helping a patient who is already extremely sickly and has, a suppressed immune system, you should not be biting off her PICC line, and you should not be not wearing gloves. I'm sorry, that's just common sense, and it infuriated me to no end. And I was like, if I get sick, it is this woman's fault. And sure enough, I did. A few hours later, I started feeling just really, really, really sickly, in a different kind of way than I already did. And my heart rate just didn't feel right. And it wasn't anxiety. I know what anxiety is. I know what it feels like. Was not anxiety. I started having a low grade temperature that fluctuate from low grade to high grade and then back to low grade, which was really weird. And I would do my antibiotic and I would feel better, and I'd start to feel worse until it came time to do my next antibiotic. And then I'd do the antibiotic and then I'd feel better, and then the same thing would keep happening. I was like, okay, this is weird. So we waited until my temperature got to about 102, I would say. And then we were like, okay, it's time to go to the hospital. So I went to the hospital, and the ER doctor was one of the most disrespectful doctors I have ever come across the entire time I've been sick. One of them, there's actually two of them at the same hospital that should have another lesson on how you're supposed to talk and treat a patient. Anyway, so she basically came to the assumption that I was having a rheumatic fever. I've never had a rheumatic fever before. I was not even hurting. I was not having a flare-up. My inflammation rate levels were not high, and I've had much, much higher. I have had inflammation levels to the point where my inflammation is so bad I physically cannot move. That was not one of those days. It was not even remotely close to one of those days. And she jumped to that assumption because I have JIA, which is, I'm sorry, but that's just stupid. It just is. And I was having a bizarre rash that kind of looked like scarlatina. I believe that's how you say it. And the nurses were looking at it and they were like, okay, that was not there 5 minutes ago, and now your entire upper body is covered. My entire upper body, except for my right arm, my PICC line was in my left arm. My right arm didn't have it, but the rest of my body did. They were like, okay, that was not there 5 minutes ago, and now it is. And then you could watch it disappear. It was so bizarre, and the nurses were watching it happen. And it just, a whole bunch of crazy stuff was happening. And I've never felt more alarmed, I guess I would say, by my body. It was like my body was trying to tell me that something was wrong. It was like it was just screaming, something's wrong, something's wrong, something's wrong. And it was so bizarre because each time I would do my antibiotics, I'd start to feel a little bit better. My ID team came and they were quite furious because they were not called when I first got there. And they were like, well, chances are you could have been having a bacterial flush from the at-home nurse biting off the cap of your PICC line and not taking care of it the way she was supposed to. And they could have diagnosed it as such had they been called in the nick of time, and they weren't. And that was the ER doctor's fault. So essentially I was admitted. I had to have the PICC line in for 2 more weeks because of that, and I was supposed to have gotten it out like within that week or something like that, and I was not happy about that at all, but I understood. And I also had the acrylic spacer removed. I believe that I was allergic to it because it felt like just crazy itchiness and craziness. Just, it was really, really itchy, and it would occasionally hit a nerve because I was unwired for like a week or something like that, or a week or 2 weeks, I can't remember. It would occasionally hit a nerve and my face would kind of just go lopsided, which was really weird. Oh, also to mention, I can feel my face again, like this section of my face. I really wasn't able to feel much after surgery, and up until a few months ago I still wasn't able to, but I can actually feel it now. And it was quite funny to my friends and family because I wasn't able to feel my chin, and if I got food on it I couldn't feel temperatures as well. So if I got like ice cream on it, I couldn't feel the coldness of the ice cream, so I didn't know it was on my chin. And they wouldn't say anything to me, of course, and just let me sit there with it because that's what friends and family do. And it got really painful, and then I knew that the nerves were trying to grow back at that point, or come back, or whatever, fix themselves. So they did. And it was also really bizarre because I could touch this part of my body and feel the exact place that I was touching it on my chin. That was so cool and so bizarre, and it was so weird. And if I hit this part of, which occasionally it still does happen, if I hit this part by accident, I could feel it in my teeth, like in my gums. It was like a sharp pinch, the same area that hurts whenever I brush my teeth. Weird how your nerves and stuff are connected, it's just bizarre. Anyway, so I had the acrylic spacer removed, and then about a week or 2 weeks later, I had a new implant put back in, and I've been pretty much just recovering and dealing with a number of other surgeries ever since. I'm looking at bilateral shoulder replacement now, and please do not say that I am too young for that, because I am too young to have arthritis, but I have it, and that is something that I have to deal with. And I know that I am 19 now, but my body is not 19. My joints are not 19. They are about the equivalent to a 80-year-old. I have had a surgeon tell me that. I've had a number of surgeons tell me that. And it's an 80-year-old who has had arthritis for a long time. So please do not tell me that. And I am getting angry because I know it happens to a number of people. It happens to one of my best friends who is in kind of the same boat as I am right now, but in a different scenario. I know I'm 19, but my body is not 19. My joints specifically, they are not 19. And so that is something that I have to deal with. If I were to treat my body like I were 19, I would be crippled and in a wheelchair right now because it would not be able to handle it. When I was 15 years old, my knee was trying to cripple itself, and had I not gone to physical therapy, which I go to every single week and I will have to for the rest of my life, I would be in a wheelchair right now. And I do not want any comments right now saying that, oh, you're too young to have shoulder replacement, you were too young to have jaw joint replacements. I'm sorry, but it was not fun not being able to eat. It was not fun not being able to carry on a conversation with my friends. It was not fun waking up in the middle of the night wanting to cry my eyes out because of how bad my pain was, but not being able to because it would just make it worse. I could go on and on and on, but please, please, please do not tell me that I am too young. If that is the way the world would work, I would just rid myself of arthritis and live the life that I want to, but I can't do that. And I don't mean to be pessimistic. I don't mean to be a pessimist. I don't mean to be negative. I do not mean to be any of the synonyms for either of those. I'm just being honest. And I know that this is not the life that I would have chosen, but it is the life that I have been given, and I will do what I will with it. I will do what I can to get to a place where I can help people, and I can do the things that I want to, and I can rescue animals and do stuff that I can't do right now, because quite honestly, it took all I had today to just get up and film this video. And it's taken me many, many weeks to just get the energy to be able to do this, because most of my energy goes into doing my schoolwork. And me doing my schoolwork consists of me sitting in my bed, doing it online because I had to leave school because of all of my health issues. And I could go on and on and on. And eventually I will, you know, do videos and stuff talking about a lot of this, but please just don't do that. I don't need it. It is the last thing I need. My implants now are fantastic. I love them. I could not be happier with them. They crick and they pop and they aren't as good as what they could be because of the stuff that happened, but they're still fantastic and I still love them, love them, love them. I was at a point where if I could go back in time, knowing what I know now, knowing that if I were to get replacements, I were to get an infection, I would do it all over again. I would go through, you know, my mom not being able to get paid for having to leave work to take care of me. I would go through having to deal with all of the heartache and all of the pain that her and my family felt because, I mean, I'm still here. I'm happy now. I am pain-free in my face now. I mean, occasionally I get weird pains and aches and stuff, which they come and go, but they're not all the time. If I could go back in time knowing what I know, I would do it all over again because my pain and my lack of mobility was that bad. It was that bad. I love my implants. I do. If it was anyone else, I can't say the same. I deal with things much differently than most people. I have gone through many, many hard times in my life, like most people. But I choose to believe that everything happens for a reason, and I choose to believe that everything that you go through makes you stronger, and you go through everything for a specific reason. And I know I'm rambling at this point, but I do feel like this is kind of necessary to be said. If it was anyone else, I don't know how people deal with things. I don't know how you deal with things. We probably deal with things differently, but I know for me specifically, I can handle hard times. I can handle difficult things. And that was one thing that was really, really difficult and really stressful and really strenuous on both my family and I, or my family and me, but I would go through it all over again. And I thankfully did not have anyone tell me that I was too young to have replacements when I was 16. I believe I had them done whenever I was 17. But we started planning for it whenever I was 16. I thankfully had no one tell me that I was too young because most everyone in my life knew how much pain I was in, and they knew how miserable I was, and they knew how much it was impacting my life. So I had support, and I'm so, so eternally grateful for that. And I'm so thankful for all the people that I've met because of the experience that I've had. And I'm so thankful for the learning experience that I've had because of it. And I'm so thankful for having the surgeon that I had. If it was any other surgeon, I'd probably have facial paralysis or horrible scarring or something like that. I don't know. But he was just on top of his game every single time he needed to be. And I've had many surgeons, take that back. I've had many doctors. Every surgeon I've had has been fantastic, but I've had many doctors who have not been that way and have made me extremely, extremely sick because they were not that way. And I am just so thankful that I had the incredible surgeon that I do. So, and I'm thankful to have been, I was his first patient to have gotten infection, and I'm thankful to have been that person because I feel like whenever you're also a surgeon, you can get to a point where everything kind of seems redundant. Everything kind of seems, I don't want to say routine, but it just, I don't know, you just need something else. So I feel like he gained a lot from that, and I feel like his residents gained a lot from it. And I'm glad to have been that person that they could have gained that from, because I was essentially okay. I mean, mentally in my head, it was really difficult socially, because whenever you're sick, people have a tendency of straying away, whether it be because they don't like hospitals, they don't like when people are sickly or something like that. They have a tendency of just kind of vanishing. And most everyone in my life kind of vanished when I got sick. And so I mostly just had my family and like 3 of my friends, and that was it. But that's all I really needed. Because, I mean, some people have no one. And there's incredible support groups and forums for that, which is really great. I didn't meet my best friend, but she kind of found me through YouTube, which was great. And I don't know how I got by without her. She doesn't even live in the same state as me. She lives on the other side of the US, and she's my best friend. I mean, it's like support. It's great to have support, even through somebody that you know through the internet. I mean, just being honest. Sometimes that's enough. But to show you, I have to be careful with my arms because they hurt so bad. But to show you my scars, they're not bad at all. They're fading really, really, really well. This side was cut into 4 times, and it still looks incredible. I mean, it's definitely a lot more visible, but I don't care. And you can see my face is far from being symmetrical. It wasn't really symmetrical before, and it kind of is a little bit, what's the word? You can notice it a little bit more now that I have implants, because the implants kind of sit on top of your face a little bit, so it kind of shows it off a little bit more, which I am not happy with at all. That is one thing that bothers me the most about all of this, is the lack of symmetry to my face. Yeah, but other than that, I mean, everything else is great. My bite is so much better. It'll never be perfect, but before I could stick my tongue, with my mouth being closed to the best of my ability, I could stick my tongue through my teeth, like through the gap of my teeth, because it was so gappy. Whenever I talked, my tongue would like slip through, so you could see it every time I talked. And it was just really weird. But that's pretty much it. I mean, yeah, it's been over a year now since my initial surgery, and May 12th, I believe it'll be an official year since my last OMFS surgery. So that's pretty much what I've gone through so far. I can elaborate on any part, any point, any topic, pretty much, as far as my face, my GIA, my fibromyalgia. I had shoulder surgery and knee surgery after my face surgery, and I'm about to have another shoulder surgery. So if anyone has any questions about any of those, or my diagnosis or anything like that, I would love to make a video about it. I'm going to post videos once every week. This was not a fun video, it was an informative video. Many of my videos will be informative, but they will be beneficial, because there are so many people out there who feel like they are alone, and that is just not okay, because I know for the longest time I felt like I was alone, and that was the biggest lie I was telling myself. And it's so easy to believe that, and it's so easy to feel like woe is me, and I want to let people know that they're not alone, because that's like one of the worst things ever. It's not fair. Everyone deserves to know that they're not alone. Everyone does. So I hope you gained something from this. If I am forgetting anything, I will get back to it. I should also probably mention that I was off of my biologic medicine for my arthritis during the whole duration of the infection and recovering from it and everything like that. And I was on a lot of prednisone, and I've been on prednisone for a really long time, but I was on a really high dosage of it, as high as we could be comfortable with it not affecting the infection and making it worse or something like that. But it is believed that my TNF blocker was a big part of the reason why my body wasn't necessarily able to take care of the infection the way it could have, because I was extremely immunosuppressed from the medicines. And so I was off of the medicine the entire time, which was not fun, and it was so painful. And yeah, so that's all I can think of right now. If I can think of anything else, I will make a part 2, and hopefully it'll be a bit shorter. I tried to make this as short as I could, but I knew it wasn't gonna be no matter what. So I hope you take care and you have a fantastic morning, evening, day, night, I don't know, whatever. So goodbye. Mwah.